Hi, I am Medicare Mama. If you follow me on TikTok here for the Medicare Family, to talk a little bit more in depth about Medicare Supplement Plan N. If you follow me on social media, you know that I really love Plan N, and I've been selling it predominantly for years, which makes me a very, very slim majority of insurance agents because the majority of agents just have sold F or G. So people are like, don't buy N. Haven't you heard with N, you could have surprise billing of $100,000. I had an agent text me about a month ago, said, my client said he had a bill of $50,000. It's like, hey, I'm in an airport, I'm doing this on my phone, but I call BS on that. That's not happening. I've been doing this too long, thousands and thousands of clients. I have never seen a bill on Plan N higher than $200. I'm not saying they can't be, but in my vast experience, I've never seen it yet. So I think saying $100,000 or $50,000 is just somebody that probably doesn't understand what they have, or they're talking about their mom or their sister or somebody and they don't really understand what they have. Because if you only had original Medicare, your red, white, and blue card, just what you get from the government, there's no end to your expenses. You could, and I've had clients that have $50,000 or $100,000 bills out of pocket. The stubborn guys are like, I don't need to supplement my Medicare. All I need is Medicare. I've had many of those clients come back in where I get to say, I told you so. I never told you guys I wasn't petty, okay? I enjoy telling them, I told you so, because I'm a specialist. This is what we do at the Medicare Family. We're 3 generations. My mom started doing this in the 80s. My sister and I have done this for 25 years, and now the 3rd generation, my son who runs the Medicare Family is in the business. We eat, sleep, and breathe this stuff. If you don't believe me, do some research. But Medicare Supplement Plan N, the part that gets everybody freaked out, is over here where it says Medicare Part B excess charges. And if you see, F covers it, G covers it, only N. That's really the biggest difference between an N and a G, is that excess. What is excess? Excess is the amount above what Medicare will pay your doctor, that your doctor's allowed to charge. So if you go in for a knee surgery and Medicare says we're going to pay $2,000 for that knee surgery, it's very low. Doctors aren't happy about how low they get reimbursed from Medicare. Your doctor says, I want more money than that. I went to school too long, my overhead's too high. So he does not accept Medicare assignment. He doesn't accept what Medicare says they'll pay. He's allowed to charge you excess, which is limited by law to only 15% above what Medicare would pay. So it's not sky's the limit. It's not $50,000, $100,000. It's not these crazy bills that you hear about. If you have a Medicare Supplement Plan N, you control it. You choose what doctor you go to. Over 85% of doctors in the whole country accept what Medicare pays. So unless you're in Florida, where it's a little bit more common, especially northern Florida, it's rare to find a doctor that actually does charge this excess. Now, you still gotta be careful if you buy that N. Every time you go to the doctor, they refer you to a specialist, you always ask and make sure I only want doctors that choose Medicare assignment, because all of this stands to change. I'm making this video here 2021. Things can change, but you still control it. I love Plan N for people that are healthy because it's a lot cheaper. You will have a copay to see a doctor. It's $20. They have not raised that since we had Plan N, which is probably 10 years. They could raise it. If they do, it'll probably go to 25 and 30, but it's cheap. You're saving more than that a month buying an N over a G. And a G is the #1 selling plan in America right now. F used to be for 45 years, but you can't buy that unless you turn 65 before January 1st of 2020. So I love Plan N because it's kind of in the middle between a Medicare Supplement G and a Medicare Advantage. Medicare Advantage, you have a copay for everything. Medicare Supplement, you have a copay for nothing. A G, all you have is that one-time deductible. A Plan N is kind of a nice middle ground. You will pay $20 every time you see a doctor, but there's no network. You will pay $50 to go to the ER. You don't pay extra to see a specialist. And you do have that excess. And that excess, not understanding the excess, oh, you do have the Part B deductible. You'll pay the Part B deductible that's equal on G or N. So I don't really talk about it. The big deal is that it's cheaper now, but that's not why I would sell it. It's because it goes up much, much, much slower than a G. And that will make you very happy as you get older because you're on a fixed income. Your Social Security is not getting bigger. but your Medicare expenses are, and it really starts to squeeze your retirement. Now, if you're really sick and you go to the doctor all the time, let's say you're seeing a doctor 4 times a month, $20 copays could add up, and I might not recommend it. You could also, with some companies, switch between plans. So if you're on an N and then you did get sick where you go to the doctor all the time, we might be able to switch you. That's very dependent on what state you're in. So let's say you're in Missouri, New York, Washington, California, Oregon, Idaho, Nevada, Illinois, Oklahoma, Maine. There's several states, by far the minority of states, but there's several states that you can switch every year regardless of your health. So that's why I said, if you're healthy now, let's put you on an N, save money. Let's keep our fingers crossed. If you would get sick as you get older, the 8 months surrounding your birthday, we can switch you and they can't deny you. We'll just move you over to a G at that time. So if you have more questions about this, call us here at themedicarefamily.com. You never pay to work with us. We're already priced into the plan, so you don't pay extra to have an agent. In that respect, we're kind of free. Because if you just call Mutual of Omaha Direct, you'll pay the same as if you call us and we recommend Mutual of Omaha, Aetna, AARP, Cigna, Humana, you get it? We work for over 150 different companies, and we really work for you. So if you want to check your plan, see if you could potentially switch, call us.
If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.